Now, after years of failed experiments, a malaria vaccine has been approved by the World Health Organization. It's a long-awaited vaccine to combat a disease that kills hundreds of thousands every year, and mostly young children in sub-Saharan Africa. We have details in this report. That report eventually as we get along. But joining me to discuss this is clinical pharmacist Nseabasi Ekanem. It's nice to have you, Dr. Ekanem. Good morning.
Good morning.
Great.
Thank you for having me.
Great. Good to see you. Now, we have what will be called a breakthrough in vaccine for malaria, which has been long awaited for the past 30 to 40 years, or maybe eternity, because malaria has always been here. But the point there is the conscious effort towards a vaccine has been on since the last 30, 40 years. Here we are with something. How much of a game changer will this be now that we have something to say close to, not 100% efficacy yet, but something close to 50, 60, or even 70% efficacy?
Okay, for me, I feel that this is a great milestone that we've achieved as a global community. We know that up until now, malaria kills nearly, 500,000 people across the world, and particularly, yes, particularly in sub-Saharan Africa. And that's why global efforts has been channeled towards, addressing the scourge of malaria, and that's why we had the Global Fund for malaria, tuberculosis, and HIV. A fund that is dedicated towards addressing the challenges of malaria across the world. Well, it's impressive that at this time we've been able to make this major milestone of discovering a vaccine. Now, the truth is that one would wonder, why did it take us this long? It is easier for us to develop a vaccine, for viruses. Very easy. It's also easy for us to develop vaccines for even bacterial infections, right? But for malaria, which is caused by the parasite known as Plasmodium falciparum, it is much, much difficult, to address, to actually develop a vaccine that will help protect an individual against a parasite like Plasmodium falciparum. Yes, we are here. And of course, we've been able to at least achieve something that will address particularly the critical population, which are our under 5 children. We know that if you look at the mortality index, the mortality chart, you see that the under 5 children suffer more fatality compared to every other population. So it is something that has come in quite tangible at a time like this for us to, help reduce mortality and even morbidity among our under 5 children. Well, that is not to say that we are not still going to adhere to other precautionary measures. Because like you said, the efficacy is actually not up to, say, a considerable percentage. That's the truth about it. Preclinical and clinical studies have shown that we might have just something within about 40% or so, and which means that 4 out of every 10 persons who take the vaccine is likely going to be protected. And that means, on the flip side of it, that about 6 persons out of every 10 may not be protected. And so that means that it has to be a combined approach. So while we take the vaccine, we still encourage Nigerians or Africans, as the case may be, to still adhere to the use of long-lasting insecticide-treated nets and other protocols that are used to prevent malaria.
Okay. Now, we'll come back to this to talk about how to access or the affordability of all of those. But let's play this report that is supposed to act as the background and foundation to our discussion. We'll be right back.
It's a disease that kills 1 child every 2 minutes. Sub-Saharan Africa carries a high share of the global malaria burden. In 2015, the region was home to 88% of malaria cases and 90% of malaria deaths globally. According to the 2020 World Malaria Report, Nigeria had the highest number of global malaria cases in 2019 and accounted for the highest number of deaths. But the fight against malaria has stepped up. Dr. Chedras said the recommendation is based on results from an ongoing pilot program in Ghana, Kenya, and Malawi that has reached more than 800,000 children since 2019. The WHO Regional Director for Africa has said the vaccine is a game changer. Chair of WHO's Strategic Advisory Group of Experts on Immunization said experiences with other infections showed clearly that a child that is repeatedly sick is maimed for life. WHO recommends that in the context of comprehensive malaria control, the vaccine be used for the prevention of P. falciparum malaria in children living in regions with moderate to high transmission. Baraka Agweremi, TVC News, Lagos.
All right, Dr. Nse Kanam is here with us. Now, when it comes to accessing this drug, we hear that Ghana, Kenya, Malawi, that is where we're starting from. But however, Nigerians were thinking, because when it comes to the prevalence of malaria and mosquitoes and its impact and effects, Nigeria has always had a higher level of burden comparative to other countries. We're thinking such kind of experiment would have started in Nigeria.
Well, yes, that is an expectation, but then there were a lot of priorities that came into the picture. We had already had the preclinical reports, and it looked impressive, all right. And then for example, there's another candidate vaccine that we have now, the one produced by Oxford, Oxford University in collaboration, with AstraZeneca, and that is another one, all right. But this one, the reason why Ghana, Kenya, and Malawi had to be used was the fact that we then looked at the fact that the vaccine, as it were, in terms of the efficacy, in terms of the safety profile, was it had a great record, particularly when it comes to safety. And we know that, of course, for Nigeria, we're already having a lot of attention with regards to malaria, tuberculosis, and of course, HIV, from the Global Fund. So it was a way of increasing access to such intervention in these countries, because when you look at access to intervention, when it comes to malaria, Nigeria has had the lion's share of attention. So we're looking at how we can improve access to malaria intervention in these countries. That notwithstanding, we know that after the trials, that definitely the vaccination rollout program will still be scaled to other countries. Like what we are expecting now, following this approval, we're looking at in the next couple of years or so, the malaria vaccine would have been fully rolled out in most of African countries. And an issue of access comes in here. How do we now reallocate the Global Fund pause, all right, that was probably tackling the rollback malaria program with regards to maybe seasonal chemo prophylaxis for malaria, looking at the insecticide-treated mosquito net. Now, we need to reallocate these funds so that a part of these funds can now go to vaccination, such that under 5 children in Nigeria can have access to vaccine. And I believe that perhaps this conversation is already ongoing at the regional, WHO regional offices, such that within the next months or so, we would begin to see some of these vaccines being rolled out in these countries. But again, care must be taken so that we don't abandon the other intervention that I talked about. Remember, we said that this vaccine is not 100%, does not have 100% efficacy. So in allocating resources to cater for this intervention, we must ensure that we are fair across board, whether it's seasonal chemo prophylaxis, whether it's long-lasting insecticide-treated nets, whether it's vaccine. Everything has to balance out so that we can now have, a multi-pronged approach towards addressing malaria epidemic in Africa.
Okay, well, we wait to see how these things are rolled out. I believe that Africans can't wait for this to get to everyone.
It's a great news.
So that malaria will be a thing of the past. You see, bye-bye to malaria. Thank you very much, Dr. Abase Kanem, for coming on the program.
Thank you for having me.
We wish you well in what you do.
Thank you.
Thank you.
Appreciate it.